Okay, good morning or good day. So this is the second lecture for Bioethics 2. Um, Now we will be tackling rights of the unborn and abortion. Okay, so I hope you already watched the movie Unplanned. So I expect um, your reaction paper on the movie. Okay, so anyhow, as I promised last time, I will first tackle more about pregnancy and the contraceptive mentality or the artificial methods of contraception, but in the light of morality or ethics. Okay, and a little bit about, of course, so since we are doctors, the medical standpoint. Okay, so we start now with the objectives of this session. Okay, so I put here for objectives, and let me just read it for you. So first, to understand the concept of contraceptive mentality within the perspective of the two ends of sexuality. So remember, during the first lecture, I reiterated that the foundation that we will be focusing actually um, for ethics too, bioethics too. Okay, it's very important actually um, that we have a very strong foundation of what human sexuality is. And of course, the issues come after. Okay, so hopefully, um, many of us, I include myself, will be enlightened um, in both areas. Okay, when I say areas or sides, no, there are pro and there are anti. Okay, so but anyhow, again, our points of discussion will be based on the official textbook rather of bioethics, which is that of Dr. Monghe. Okay, so second, to qualify the rights of the unborn. Okay, are they considered human person with full rights like adults or not? Okay, so that is a big issue. Okay, so again, I will try to discuss it in the perspective of life, the definition of life, the beginning of life. Okay. Third, to analyze the mechanism of the pill. Okay. So again, no, last week, um, I also told you that I will discuss a little bit about the pill. Okay. So not all of it, but um, something which I think will help us all to understand the pill. Okay, as contraceptive in or abortive or abortifacient in the medical and or within the medical and moral perspectives. Okay, so we will see that also. I know we have all our opinions, so let's see um, how will we understand, how will we accept, or how will we maintain our stand. Okay, so fourth, to understand abortion vis-a-vis the different laws and principles of bioethics. When I talk about laws, okay, so it's understood, guys, that we're talking about natural law and the other laws which actually can be used as basis, okay, in defending um, definitions or even opinions, okay, so coming from the natural law, okay, so it stemmed, so the different laws, specific laws actually stemmed from the natural law, okay, and then of course the principles of bioethics. So we know this from first year, the four principles of bioethics. So beneficence, non-maleficence, autonomy, justice. Okay, and other principles we've tackled uh, during your first year. Okay, but we will just go through um, some of the important principles and law, okay, natural law, okay, when we discuss the rights of the unborn, and abortion. Okay, I will try to make this short. Okay, so again, no, last week, um, uh, I, 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 I told you that I will not be discussing pregnancy um, in details last time because I want to connect it with the topic this week, which is abortion. Okay, so but don't expect me to talk about pregnancy um, in terms of the development of the fetus, etc. So it's part of OB already. So when we talk about pregnancy in the light of um, ethics or morality, so a very important question um, is actually or should actually be answered. Okay. So this question is this: when does life begin? Okay, so if you read, there are a lot of materials available in the internet or even in the books. So print out or yeah, in social media, even in social media, okay, ebooks, etc. Okay, so there are a lot of different opinions, I may say. Okay, but let us talk about basic biology and the basic knowledge that we know of. Okay, when does life begin? Okay, so simply put, it's during fertilization. Okay, so when the sperm fertilizes the ovum, okay, and forming a zygote. Okay, so that's the process of fertilization. Why did I say that life begins during fertilization? Okay, for some during conception. Okay, so kaya lang kasi when you say conception, oh, okay, so the other detailed scientists, okay, will ask, okay, so when in conception, during implantation, or during at some weeks, or when the fetus is considered viable already. So anyway, but in biology, we know that life begins at fertilization. The moment the sperm cell fertilizes the ovum. Okay, so why? Why do we say that? Because of the science of life. Okay, so practical. Okay, so there's cell division. Okay, the classic examples that I actually give is a question also. Okay, so does a chair um, uh, go through cell division? Okay, a chair, a chair itself. Okay, no, right? So why? Because it's an inanimate object. Okay, when we say inanimate object, it's dead. Okay, it is not alive. Okay, because if a chair is alive, then probably your chair, the chair that you use for studying after few months will grow leaves. Okay, or even becomes bigger. Okay, so okay, cell division. And then there's constant development and growth. Okay, so these are the two very practical, okay, signs of life. Therefore, life begins at fertilization. Period. Okay. Don't qualify it. No, 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 no. Okay, so when the zygote is able to implant herself or himself, I don't want to call it itself because he or she. Okay, so it's just a matter of time when the gender um, is revealed. Okay, so we know that. Okay, and you will actually discuss it in OB, so OBGYN. Okay, all right. So okay, so I again go back to my question last week. Is pregnancy a disease? Okay, so it is not. Why? Because pregnancy is naturally part of the biological makeup of women. No? Women were made to actually become pregnant. So they're the only ones who can actually become pregnant. But of course, there's uh, this sentence they say, it takes two to tango. But, okay, the one who carries the baby, okay, is the woman. Okay, so of course, no, there are organic abnormalities, imbalances. So there are infertile. So infertility is a problem. Infertility is a disease. Okay, it's an organic abnormality. Okay, but pregnancy is not. Okay. Second, it is predictable. Okay, with definite timeline. Okay, so how come? How come, doc, it's predictable? Okay, so yes, you have evidences. So when a woman, okay, does not have or his menstrual cycle, okay, halts, okay, and if the woman mm, is actively uh, in a relationship, okay, yeah, so sexually active for that matter, okay, then she knows that when her menstruation stops, there is a possibility. And the first thing that anybody considers is actually pregnancy, okay, before anything else. Okay, um, so you know um, when you start become pregnant because we can compute it, okay, from the day of your last menstrual period. And we already know that it takes 9 months, okay, for a full-term baby to develop in the womb of the mother or of the woman. Okay, so it has definite timeline. For diseases, of course, there are already diseases established for the past decades um, of predictable. Okay, so meron ng mga predictions, no? But you will never know when you will get infected. So hindi mo yun mapipredict. Okay, so when you go out now and then you contract suddenly an infection, okay, so you never predicted that. Unlike with pregnancy, okay, if you engage in sexual activity and your menstruation stops, then okay, you already have an inkling. Oops, I may be pregnant. And you start computing. Okay, start computing after you test for pregnancy. No, okay, I'm positive. But with diseases, you cannot predict it. Okay, probably um, uh, for cancer, for example, tataningan ka lang. But you will never know if you will really um, live for what? How many months? How many years? No. No? Okay. I hope you get it, no? So it's not a disease. Okay. It's not an unexpected imbalance. Again, no? Okay, I will go back to the two ends of sexuality. So we cannot um, dissociate the two. Okay, so unity and procreation. Okay, so when there's sexual union, you already expect that the most probable consequence of that union is procreation, okay, pregnancy. So it is not an unexpected imbalance. Okay, so of course, medically, we will see that the body of the woman adapts to the pregnancy. Of course, there are more more food intake because you're already carrying another human being. So anyway, but it is not. It is never an imbalance. Okay, doc. So what about abnormal pregnancy? Okay, so I have a very specific topic because this was asked by a student in another section, okay, last week. So I didn't actually answer her, okay, because I want to discuss it, okay, this week. Okay, so abnormal pregnancies, they're really such a thing. Okay, so abnormal pregnancy, um, pregnancy becomes abnormal when uh, the natural development of the fetus, okay, or mm, yeah, is halted, okay, in terms of preterm, okay, so preterm labor, okay, or preterm pregnancy, okay, kulang sa buwan, okay, so can be considered abnormal pregnancy, diba? Kulang kasi sa buwan, no? Or the cases of ectopic pregnancy. Okay, so ano ba ang ectopic pregnancy? What is ectopic pregnancy? So it's pregnancy, okay, there is a zygote, okay, there is a fertilized ovum, okay, and then continues to develop, okay, cell division, and then later on organogenesis, etc. Okay, so constantly developing, and constantly growing, but okay, was not able to implant, okay, herself or himself in the natural environment for pregnancy. Okay, probably it was not motile enough, and the zygote remained in the fallopian tube. Okay, so um, uh, so it grows, or rather, she or he grows in the fallopian tube, okay, which is not the natural environment. Why? Because it's limited. Okay, tube lang siya eh. Okay, unlike when he or she implants himself or herself in the fundus, in the upper two-thirds of the uterus, then there is a space to grow, because the uterus was really made for the growing fetus. Okay? So when we talk about ectopic pregnancy, this is pregnancy outside the natural environment, which is the uterus. Okay? For pregnancy. No? So pwedeng fallopian tube, sometimes sa abdominal area, hindi na nakapasok sa fallopian tube. Okay? So areas other than the uterus. Okay? So first, when we talk about ectopic pregnancy, again, no, it's an unnatural environment for the fertilized egg. Okay, unnatural. Okay, and then there is danger for both lives, the mother and the fetus. When in fact, in OB, when when a mother comes in with abdominal pain, okay, and the mom knew or knows that she or he, rather, sorry, that she is pregnant, then ultrasound, or yes, so immediately um, she will be put under ultrasound, okay, and kung wala pang ultrasound, okay, so usually, kunwari, a few weeks lang, so hindi pa nagpapaprenatal, so yun, so severe abdominal pain, okay, so the management actually is, yeah, um, it's surgical, no? Surgical. Kasi kung hindi, for example, ectopic pregnancy, most common site is actually the fallopian tube. So talagang tatanggalin. Why? Because the danger of bleeding, okay, for the mom, it's dangerous, and it's the fetus will never reach viability. Okay, will never reach viability. Okay, so morally, um, the surgical management for ectopic pregnancy is licit, okay, and morally permissible. Okay, klaro yon, no? Because ectopic pregnancy, as I've said, okay, uulitin ko, okay, it's the unnatural environment for the fertilized egg, and it's dangerous for both lives, the mother and the fetus. Okay? Okay, now about the pill. Okay, let's be clear and direct when we talk about the pill. And we know that the common contents of the pill are hormones, the women's hormones. So either it's um, estrogen or progesterone. Okay, so um, it was developed. Okay, so medically, in, 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 in the area of medicine, in the area of science, the pill, it's a drug. Okay, it's a drug which was developed, okay, to manage gynecological abnormalities. Okay, most common is the abnormal menstrual cycle, abnormal uterine bleeding, even PCOS, okay, polycystic ovarian disease. No, so um, it was actually and primarily developed for that. Okay, that's why I wanted you to watch the documentary because it presented the sexual revolution para maintindihan natin, no? Ano bang nangyari during the sexual revolution? Okay, so and we've seen that there was really a lot of clamor, okay, for equality, for gender equality between men and women that time. Okay, so the rights of women, etc. So the rights of women were put forward, but caveat was they also mm, um, discovered that the side effect of the pill is actually to halt pregnancy. Okay, for some, they want it uh, more palatable I mean, palatable in the ear. Okay, it's to delay pregnancy. Okay, so that was it. But for us doctors, we cannot deny this that it was really mainly okay. And it is and should be mainly to manage gynecological abnormality. Okay. Now we go to this, no? So this can be um, a little bit controversial. Okay, so the mechanisms of the pill can actually be both contraceptive and abortive. Okay, so it's a contraceptive and abortifacient. Okay, so why? Okay, because when you say abortion, um, you terminate pregnancy. Okay, you terminate pregnancy. Tama naman. Okay, and when you say contraceptive or contraception, you prevent pregnancy. Okay, but what is the mechanism of the pill? Okay, what is the mechanism of the contraceptive pill? Okay, actually it alters the environment, okay, the uterine environment. Okay, let's be very clear. The uterine environment, it alters the uterine environment, making it not conducive for pregnancy. Okay, actually I have okay, I think the next slide. Okay, why hormonal and chemical contraceptives? Sorry, I'm so sorry. Okay, so why take two? Okay, so why hormonal and chemical contraceptives also considered abortive or abortifacient? Okay, so these are the reasons. Okay, so first, this is the primary reason. It makes the environment of the uterus not conducive for conception. Okay, and actually in ethics, okay, you you go to the end. Okay, you go to the end, no? What is the end of contraceptives? To prevent pregnancy. What is the end of abortion? Actually to end pregnancy. Okay, actually both um actually don't want pregnancy. Okay, so yun, no? Okay, so that's why I was also trying to explain to you the contraceptive mentality. Okay, that even if the couple decides to do the natural method of family planning, but okay, their intention in the first place was to not to beget children, that is already a contraceptive mentality. There is no difference with a couple who uses the artificial means of contraception. Okay? Kasi pareho sila ng end. No? I hope that's clear. That's the contraceptive mentality. Okay? So, to be responsible parents, okay, um, we have to be open to life. Because again, no, I will go back. Okay, ang kulit ni Doc. Okay, so, oo, kukulitin ko kayo talaga. Okay, but, the two ends of sexual union cannot be separated. So, union, unitive, and procreative. Hindi pwede. Okay, because in the unitive, pleasure, okay, is already attained. Okay, but it is not complete because you are not open to life. which is a very important end of sexual union, which is procreation, begetting children. Okay, so anyhow, so ito lang yun. It makes the environment of the uterus not conducive for conception. Okay, I will give you an example. Um, uh, and this case, although I'm just making it up, already happened. Okay, and can happen and is happening. Okay, so a case of a couple who is on fifth year of contraceptive pill. So I always discuss contraceptives, okay, contraception within the context of a relationship, okay? Hindi pwedeng ako lang, alam mo yon. So dapat nasa context ng relationship, okay? So hindi a single person, okay, unless she is having menstrual problems, cannot actually engage in contraception. Okay? Bakit? Eh, hindi ka naman, unless you're sexually active and alam mo yun, walang commitment. Pero, anyway, so it's another, it's another issue. Okay, but we go back. Okay, so this is my example. A couple who is in the fifth year of contraceptive pill, they decided to stop using contraceptives, okay, because they already want to have children. So, alam na natin may contraceptive mentality. So, if I ask you to analyze the case in the perspective of morality and ethics, so alam na natin, no, contraceptive mentality, nadidissociate na yung dalawang ends ng sexual union, which is unitive and procreative. Doon pa lang, mali na. But anyway, we continue on. So, they decided to have children, so they stopped using contraception. Okay. However, after trying for 2 years with several miscarriages, okay, they consulted, okay, an expert on fertility because they thought it's actually it's actually a fertility problem. So okay, anyway, fast forward. Okay, so after they consulted, the fertility expert actually um, pinpointed one problem, which was the chronic use, or which is the chronic use of contraceptive pill. Okay, as an effect for using contraceptive pills for 5 years continuously, the uterus of the woman became not conducive for pregnancy. Okay, so they have to wait for more years to try, okay, because it's not a problem of fertility. Because may na-form sila eh. Anong nangyayari? Okay? At a certain month, nalalaglag yung bata. So that's an indirect abortion, no? Miscarriage. Okay? So bakit? Yun na nga. Okay? That's one effect that many doctors, okay, so maraming in denial, pero marami din namang nakikita na totoo yun, that contraceptive pills, okay, because it's being used for the side effect. Naturally, it was not for it. Okay, again, no, natural po. Okay, what is unnatural is, yeah, sad to say, it's morally and ethically not permissible. Okay, so that's the problem, no? Okay, so there, uterus becomes not conducive for conception. So, ang indirect effect niya, hindi niya alam, ay miscarriage, which is actually abortion, abortifacient. It's not the direct abortion, which I want you to actually focus on when you read and go back to Monge. Okay, so the direct abortion, or induced abortion, which is direct and indirect. Okay, Hindi ko yan i-discuss na dito. Okay? So, and then another example that I put here is IUD. It's a foreign body, no? Considered foreign body. Okay? It is implanted, okay, to block um, the motile sperm to meet the ovum, or vice versa. The ovum cannot actually also meet, okay, the sperm cell, okay, because there is a block, okay, so yun barrier pero sa loob magkaiba yan sa condom, okay, so condom cannot be abortive, no, kasi nga barrier lang siya, okay, but still it's contraception, okay. So anyway, IUD blocks or prevents fertilization and or implantation to occur. Sometimes there are already cases for the past decades that even with IUD, okay, fertilization can occur. Kaya lang, hindi na makamove yung zygote. Okay, so, mas madaming cases ng ectopic pregnancy. Nakita nila yon. Okay, so this is evidence-based. Okay, so because of IUD. Kaya actually, for the past years, hindi na yan masyadong marketed. Okay, so ang nagiging more in the market is the hormonal chemical contraceptives. Okay, so there. Again, no, if you have questions, you can actually uh, send me a message, okay, via Moodle, or you look for me in Telegram. Ayaw. Okay, so there, this is abortion. I will not go to the definition of abortion. I will, uh, yeah, I will give it to you. Okay, it's your responsibility. But again, no, you concentrate on induced abortion. Okay, so there are two um, classifications which were put forward by Dr. Monghe, direct and indirect. Okay, so definitely abortion is morally and illicit. Morally illicit. It's morally not permissible, and it's illicit. Okay, especially in the family code of the Philippines. Okay, this is the morality. I will jump to the morality of abortion. So nothing will justify the direct act of murder. It's actually murder, period. It's actually killing. Okay, so I can discuss here a little bit about the rights of the unborn. So let's qualify the rights of the unborn. Okay, so like anyone else, okay, the unborn is a creature. Okay, the unborn is alive. Okay, uh, the qualifying factor there is um, the unborn is not yet able to decide for herself or for himself. Okay, um, but he or she has the potential, so potency. Okay, so she or he is actually in potency. In philosophy, um, yun ang ginagamit, no? So he or she is in potency. Okay, potency meaning it's just a matter of time for the unborn to become like you and me. Okay, so grown ups, adults. Okay, and yet he or she has the right to life, like you and me. Okay, so um, uh, dito pumapasok yung proxy. Ayan, but he is already considered, or he or she is already considered a human person. Okay? Oh, Doc, proxy pala eh. He or she cannot decide for herself. Okay, but he or she is already a human person. And um, uh, to abort or to halt his or her development is already considered murder. Okay, um, he or she is in no way owned. Okay, owned by anyone. Okay? So we have to respect that. Okay? However, yung autonomy niya, okay, when we talk about the principle of autonomy, is not full yet. Okay? But at the same time, he or she is not owned by anyone, even the mother. Actually, the woman carrying her or him has the responsibility to take care of him or her. Kasi sabihin ng mga iba, okay, it's so unfair. Okay, it's so unfair. Again, no, babalik ka talaga, okay, sa basic foundation. Hindi mo kasi talaga pwedeng, you cannot separate the two ends, okay, of unitive and procreative. Kasi dun pa lang, pag hindi na yun malinaw sa ating lahat, then it's so easy to decide, okay, I'm gonna abort because I'm responsible. It's just a matter of choice. No. Okay? Um, uh, the other side of the coin is responsibility. Okay? Your freedom is respected, but at the same time, kalahati lang yun. So, kabila, may responsibilidad. Okay? And again, no? The individual good is lower than the good of the community, or what we call common good. Okay? In apparently special cases such as danger to the life of the mother, case of rape and incest, tingnan nyo, special cases, quote-unquote. Again, abortion is never an option, cannot be an option. Abortion is still illicit and not morally permissible. Okay, so, huh? Bakit? Okay, so bakit, no? Okay, so example, for the danger to the life of the mother, with the advances of medicine now, ito yung, this is the one which the indirect type of induced abortion is actually pointing at. Okay? Before it's termed therapeutic abortion. Okay? So they end pregnancy in order to save the life of the mother. Okay? Because of um, underlying conditions. Okay? So like, chronic diseases, congestive heart failure, tuberculosis, and even infections. So this is HIV. Okay? And even now, siguro probably coronavirus infection, because this is the newest, no? Cancer for that matter. But with the advances of medicine now, um, you can wait until full term. Okay? You can wait until the baby is considered viable. Okay? Viability. So, viability, ang ibig sabihin nun, when the baby is out from the womb of the mother, then she or he can survive already. Okay, so, kaya lang of course, ideally, it's better. So it's better to wait full term, okay, for everything, for organogenesis to be maximized, okay, so lahat, pati yung immune system, etc. Okay, so with the advances of medicine now, a mother who has myoma, okay, myoma can actually deliver full term, okay, so without I'm not saying without risk, but with risk, but the percentage of survival is higher. Okay. Okay, so how about doc yung mga mothers na may underlying diseases? Guys, ito lang yun eh, simple lang ako mag-isip. When the woman choose to get pregnant, okay, panindigan niya yon, 'di ba? Whatever condition she may have. Okay, so yon. But of course, with the advances of medicine, um, sabay yon sinusuportahan yung mother. Kaya prenatal check-up, everything. So all the check-ups that a pregnant mother should undergo should be done. Okay? And then second, case of rape and incest. Hala, hindi naman kasalanan ng bata. Okay. So, Doc, paano yung emotional suffering or psychological suffering of the woman? Syempre, hindi rin naman din niya kasalanan. Yes, walang may sala. Kaya bakit mo i-terminate yung isa sa kanila? Okay? So, support, no? The social support is very important. Mm, Still unfair because you're not the one going through the hardship. Oo. Pero it's also unfair. Lack of justice to the unborn. So again, no? That's one of the rights of the unborn. So justice. So under the principle of justice, um, everybody has the right to life. No? So, yun. So, again, no, with the advances of counseling, of psychiatric support, mental awareness, etc. Okay, so, um, abortion for cases of rape and incest is not an option. Okay, so, what is the better option? Support. Support the victim, and then adoption if later on, even after the victim recovers from the condition, okay, um, he or rather she still decides not to take care of the child, then adoption. Okay, so adoption is an option. Okay, but never abortion. Okay. Okay, so in the materials or in the syllabus, if you go back to it, so there's uh, a short film or a short documentary, Silent Scream. You can just Google it. So it's available in YouTube. I did not precisely uh, uploaded it. Okay, so yeah, you just look for it in YouTube, Silent Scream. So this is about a doctor, an OB-GYN, Dr. Nathanson, okay, who saw, yeah, and you will see it, okay, you will see it. And of course, the case of Roe versus Wade. Okay, so this is the benchmark, the landmark case, okay, for abortion. Okay, so you just read the history, at least to understand um, why abortion became legal in the US. Okay, so this is the landmark case. So just a quick summary. Okay, so Roe, this is not her name. So, but she's a 20-year-old lady um, who was fighting for her right um, to abort her third child, okay, for some reasons. And Wade was the district attorney of Texas, where the case was um, filed. Okay, so anyway, you will read it. Roe versus Wade. In the end, it went to the Supreme Court. Wade did not approve it in Texas, but Roe fought for it. Roe fought for it, and until the Supreme Court decided, okay, on this case. Okay, so that's the landmark case for abortion in the U.S. Although even before the case was discussed, um, there were already states in the U.S. Where abortion was permissible. Okay, so this is the decision of the court. Okay, so the court divided pregnancy into 3 trimesters. So during the first trimester, the court declared that the choice to end the pregnancy was solely up to the woman. So obviously, Roe won the case. Okay, that's why it became the landmark case for abortion in the U.S. Okay, and during the second trimester, the government could regulate abortion, although not ban it, in order to protect the mother's health. Okay, and during the third trimester, The state could prohibit abortion to protect a fetus that could survive on its own outside the womb, so viability, except when a woman's health was in danger. Okay, so anyway, um, in the movie that you've watched, that I let you watch, uh, Planned Parenthood um, was yeah, was shown there. So it is where Abby, the protagonist, this is a true story. This is the story of Abby. Okay. Uh, anyway, was depicted. So Planned Parenthood was shown there, and they're the ones who actually are for the abortion and all women's rights in the U.S. So they're the more active um, institution. Okay, so anyway, so that's my last slide. Again, if you have questions, you can send me a message in Telegram. Look for me at Dr. Des Daniega. Okay, I can actually, or we can discuss individually if, yeah, if you're interested and if you have questions. Okay, so that's it. And please read chapters 1 and 2 of Monghe, of Dr. Monghe, and of the part 2, already the part 2 of the book.